A heart attack happens when blood flow to the heart muscle is blocked. This blockage is usually caused by a blood clot. Without enough blood, the heart muscle can be damaged or even die. This is a serious medical emergency that requires immediate attention. Recognizing the signs and symptoms of a heart attack and seeking prompt medical help can be life-saving. It is important to understand that heart attacks can present differently in different individuals. While some people experience the classic symptoms, others may have mild or atypical symptoms, making it crucial to be aware of a range of potential warning signs. By understanding what a heart attack is and how to recognize its signs, you can take proactive steps to protect yourself and your loved ones. Heart attacks often present with a combination of recognizable symptoms, but these signs can sometimes be subtle or mistaken for less serious health issues. Understanding what to look for can make all the difference in getting timely help and potentially saving a life. However, it's crucial to remember that not everyone experiences all of these symptoms, and the intensity can vary from person to person. Some people may have only mild discomfort, while others experience severe pain. In some cases, symptoms can be so mild that they are dismissed or ignored, especially among women, older adults, and people with diabetes. The most common warning sign is chest pain or discomfort. This can feel like uncomfortable pressure, squeezing, fullness, or outright pain in the center of the chest. It may last for more than a few minutes, or it might go away and then return. Some people describe it as a heavy weight pressing down, while others feel a burning or tightness. It's important to note that chest pain doesn't always feel severe. Sometimes it's just a mild discomfort that can be easily overlooked. Shortness of breath is another significant warning sign. You might feel like you can't catch your breath, even when you're sitting still or not exerting yourself. This symptom can occur with or without chest discomfort, and it may come on suddenly or gradually. Difficulty breathing can be frightening and is a clear signal that something is wrong. Pain or discomfort can also radiate to other areas of the upper body. This includes pain in one or both arms, the back, neck, jaw, or even the stomach. Sometimes the pain might start in these areas and not in the chest at all, which can make it harder to recognize as a heart attack. For example, some people feel pain that spreads down the left arm, while others might notice discomfort in the jaw or upper back. Breaking out in a cold sweat is another warning sign. This type of sweating is sudden, unexplained, and often feels cold and clammy. It's not the same as sweating from exercise or heat. If you find yourself sweating profusely without a clear reason, especially if it's accompanied by other symptoms, it could be a sign of a heart attack. Nausea or lightheadedness are also possible symptoms. You might feel sick to your stomach, vomit, or feel dizzy and faint. These symptoms are sometimes mistaken for a stomach bug or dehydration, but when combined with other warning signs, they should not be ignored. Feeling unusually weak or suddenly fatigued can also be a red flag, especially if it comes on quickly and without explanation. If you experience any of these symptoms, especially if they are severe, persistent, or occur together, it is crucial to seek immediate medical attention. Don't try to wait it out or drive yourself to the hospital. Every minute counts when it comes to heart attacks, and fast action can save your life or the life of someone you love. Do not hesitate to call emergency services right away. Trust your instincts. If something feels seriously wrong, it's always better to be safe and get checked by professionals. Enjoying the video so far? Don't forget to like and subscribe for more insights. While both men and women can experience the classic heart attack symptoms, women are more likely to experience some symptoms differently, or have additional symptoms along with the more common ones. Women may experience unusual fatigue, feeling extremely tired or weak even after resting. Sleep disturbances like difficulty falling asleep or staying asleep can also be a sign. Indigestion or heartburn, which is a burning sensation in the chest or upper abdomen, may occur. Anxiety or a sense of impending doom, feeling extremely worried or uneasy, is another possible symptom. It's essential for women to be aware of these subtle signs and to seek medical attention if they experience any unusual or persistent symptoms, especially if they have risk factors for heart disease. It's crucial to understand that heart attack symptoms can vary significantly from person to person. Some individuals may experience very mild symptoms, while others may have more severe and debilitating symptoms. Some people may only experience a few of the common symptoms, while others may experience many. Factors that can influence how a heart attack presents include age, gender, overall health, medical history, and severity of the blockage. This variability in symptoms highlights the importance of seeking medical attention for any unusual or concerning symptoms. even if you are unsure if it's a heart attack. If you suspect that you or someone around you is experiencing a heart attack, it is absolutely crucial to take immediate action. Heart attacks can happen suddenly and without warning, and the first few minutes are often the most critical. Recognizing the signs and responding quickly can mean the difference between life and death. Don't hesitate or wait to see if the symptoms will go away on their own. Every second matters. Here are the essential steps you should follow if you find yourself in this situation. Having a clear plan in mind can help you stay focused and act decisively, even in a stressful moment. First and foremost, call emergency services. Dial your local emergency number immediately. In most places this is 911, but it may be different depending on your country. Don't try to drive the person to the hospital yourself unless there is absolutely no other option. Paramedics are trained to provide life-saving care on the way to the hospital, and they can begin treatment as soon as they arrive. Next, try to stay calm and reassure the person that help is on the way if you are with someone experiencing symptoms. Panic can make the situation worse, so speak in a soothing voice and encourage them to sit down and rest while you wait for help to arrive. If you are the one experiencing symptoms, try to remain as calm as possible and let someone nearby know what's happening. Then, loosen any tight clothing, such as a collar, tie, or belt. This can help the person breathe more easily and feel more comfortable while waiting for emergency responders. If possible, have them sit in a comfortable position, preferably with their back supported and knees bent, to reduce strain on the heart. If the person is conscious, alert, and able to swallow, give them an aspirin, unless of course they are allergic or have been told by a doctor not to take it. Chewing the aspirin is best, as it allows the medication to enter the bloodstream more quickly. Aspirin can help slow the formation of blood clots, which are often the cause of heart attacks. Aspirin works by thinning the blood and can potentially improve blood flow to the heart, reducing the severity of the heart attack. However, never give aspirin to someone who is unconscious, having trouble breathing, or showing signs of a severe allergic reaction. Also, be prepared to provide the emergency operator with important information. This includes your exact location, the person's age, any known medical conditions, medications they are taking, and a clear description of their symptoms. The more details you can give, the better prepared the emergency team will be when they arrive. Remember, every minute counts during a heart attack. Taking swift, decisive action can make a life-saving difference. Don't delay. Your quick response could save a life, whether it's your own or someone else's. Stay alert, stay calm, and always be ready to act. Calling emergency services immediately is the most crucial step in responding to a suspected heart attack. Here's why. Emergency medical personnel are trained to recognize and treat heart attacks quickly and effectively. They can begin life-saving interventions on the way to the hospital. Ambulances are equipped to transport patients to the hospital rapidly and safely, ensuring they receive timely treatment. Emergency medical personnel have access to life-saving equipment, such as defibrillators and medications that can be critical in treating a heart attack. Never hesitate to call emergency services if you suspect a heart attack. It's always better to err on the side of caution. The phrase "time is muscle" is often used to emphasize the importance of prompt treatment for heart attacks. When a heart attack occurs, the heart muscle is deprived of oxygen-rich blood. The longer this deprivation lasts, the more damage occurs to the heart muscle. By seeking immediate medical attention, you can minimize heart muscle damage because prompt treatment can help to restore blood flow to the heart muscle and minimize the extent of damage. Acting quickly significantly increases the chances of survival and reduces the risk of long-term complications. Early intervention can lead to better recovery outcomes and improve overall heart health. Remember, every second counts during a heart attack. Don't delay seeking help. Knowledge is power, especially when it comes to heart health. The more you know about how your heart works and what can go wrong, the better prepared you are to make choices that support your well-being. Taking the time to educate yourself about heart health is one of the most important steps you can take for yourself and your loved ones. By understanding the signs and symptoms of a heart attack, you empower yourself to take action and potentially save a life, your own or someone else's. Recognizing early warning signs such as chest pain, shortness of breath, or discomfort in other areas of the upper body can make all the difference in an emergency. Quick action can mean faster treatment and a better chance of recovery. Here are some ways to stay informed. Start by reading reliable sources, such as brochures from your doctor or trusted health websites. Take notes, highlight important information, and keep a checklist of symptoms handy. Staying organized helps you remember what to look out for and what steps to take if you or someone you know experiences symptoms. Talk to your doctor and discuss your risk factors for heart disease, such as family history, lifestyle, and any existing health conditions. Your healthcare provider can help you understand your personal risk and recommend steps to lower it, such as changes in diet, exercise, or medication. Don't hesitate to ask about any concerns you may have. No question is too small when it comes to your health. Open communication with your doctor ensures you have the information you need to make informed decisions and feel confident about your heart health. Knowing CPR can equip you with the skills to provide immediate assistance in an emergency situation. Taking a CPR or first aid class not only boosts your confidence but also prepares you to act quickly and effectively if someone around you needs help. These skills can truly be life-saving. Share this information with your family and friends because heart health is a community effort. When everyone is informed, you create a support system that looks out for one another and encourages healthy habits. Make sure your loved ones are also aware of the signs of a heart attack and the importance of acting quickly. Discuss what to do in an emergency, and consider watching educational videos together or attending a seminar as a group. The more people who know what to do, the safer your community becomes. By staying informed and proactive, you can play an active role in protecting your heart health and the well-being of those around you. Remember, every step you take to learn more and share your knowledge brings you closer to a healthier, safer future for yourself and your loved ones. Empower yourself today because knowledge truly is the first step to prevention and care. Heart disease is a leading cause of death worldwide, but many of these deaths can be prevented through awareness, early detection, and prompt treatment. By spreading awareness about the signs and symptoms of heart attacks, we can empower more people to recognize the warning signs and seek timely medical attention. Here are some ways to spread awareness. Share this article and other reliable resources with your social networks. Talk to your friends, family, and colleagues about heart health. Consider supporting organizations dedicated to heart disease research, prevention, and education. Together, we can make a difference in the fight against heart disease. We hope you have enjoyed this video. Don't forget to give us a thumbs up and subscribe to Health and Lifestyle. Ring the notification bell so you'll always get more helpful tips from Health and Lifestyle. Thank you for watching. By spreading awareness, we can save lives.